If you're new to Medicare or not, you may be wondering what is the difference between Medicare Supplement Plans and Medicare Advantage Plans. If that is you, stick around. Hi, my name is Rick MacDermid with Senior Solutions Group, and we help people plan for Medicare and retirement. One of the things I get asked all the time is, what is the difference between Medicare and Medicare Advantage? So Medicare is government health insurance for people 65 and older or people with disabilities who are on Medicare due to a disability under age 65. So when you're new to Medicare for the very first time and you're 65 and older, you have a window of time where you can pick either a Medicare Supplement Plan or a Medicare Advantage Plan. Why would you want a Medicare Supplement Plan? If you end up in the ambulance before you get to the hospital, just the ambulance alone, Medicare is only going to pay 80%. And then when you go to the ER, Medicare is only going to pay 80% of the bill. So if you end up needing a lot of tests, so let's say you go into diabetic shock and you have to get tests, maybe you don't even know you have diabetes. All those tests to determine that you even have diabetes is going to cost a lot of money. You're going to pay 20% of that bill. And what if you need a lot of follow-up care? You're going to continue to pay 20% of the bill with no end in sight. There's no cap on the 20%. So only having Medicare Part A and B could cost you thousands and thousands of dollars. Another example, what if you're hiking or if you're camping? What if you're out in the wilderness camping and you need to be airlifted to a hospital? Let's say you fall in a ravine and break your leg and you need to be airlifted, or if you have a heart attack in the middle of the woods. That airlift could cost you $50,000. What's 20% of $50,000? That's $10,000 before you even get to the emergency room. Then when you get to the emergency room, you're going to pay 20% of that bill. If you're admitted overnight to the hospital, you're going to pay over $17,000 each and every time you're admitted to the hospital. That doesn't include if you need skilled rehab care, which could be another $16,000 because you're going to pay up to $200 and change per day from day 21 through day 100. That's why people often select a Medigap plan, also known as Medicare Supplement Insurance. So Medicare Supplement Insurance works very simply. You pay an insurance company so you don't have to pay the 20% of the cost. Now you may pay a very small portion of the cost, maybe a $20 copay when you go to a doctor. And most Medicare Supplement plans also cover all or a portion of the deductible for the hospital stay. And some plans will even cover the copay for the skilled rehabilitation center. So when you go to a hospital by ambulance and to the ER and get admitted to the hospital, your out-of-pocket cost, if you pick a plan such as a Plan G or a Plan N, you would only have to pay maybe $50 for the emergency room, $0 for the ambulance, $0 for your hospital stay, $0 for your skilled rehab care, and then any follow-up care for your doctor, you'd either pay $0 or you'd pay maybe up to $20 as long as your doctor fully accepts Medicare. And that's the main rule. Your doctor and your provider has to accept Medicare. Well, about 98% of doctors nationwide accept Medicare. So as long as you go to a doctor that fully accepts Medicare, you'll have little or next to none out of pocket. By the way, anyone that is on Medicare, new to Medicare 2020 and beyond, up till today, will have to pay a deductible once a year. This year it's $257. Next year it could be $267. So in the fall, every year, Medicare will announce what the deductible is for the following year. So we don't know what the deductibles are going to be for next year. So when you have a Medicare supplement plan, you don't have to worry about which doctors you can go to. As long as they accept Medicare, there's no networks. You don't need to get a referral. The coverage is guaranteed for life, and there are typically going to be no prior authorizations. Now, next year, Medicare is going to have a test run for prior authorizations under a pilot project in 6 states. We're one of the states. But that's only for a very small subset of conditions that have been more highly susceptible to fraud, waste, and abuse. People are used to prior authorizations. If you're on an employer plan or if you're on health exchange plan, you are used to needing a prior authorization if you need an MRI or a surgery. Medicare A and B typically doesn't require that. So that's another beautiful thing about Medicare supplement insurance. If Medicare pays, by law, your supplement plan has to pay their part. No ifs, ands, buts, or maybes. So you're not going to be fighting with an insurance company. You're basically paying the insurance company a monthly premium so they can buzz off. As long as you pay your premiums, they cannot deny your claim by law. And you can never be dropped from your insurance company except for one reason. That's due to non-payment. And let's talk about payments. We are seeing an increasing premium increase environment over the last couple of years. So we are seeing some larger rate increases. The other reason that people often look at Medicare Advantage is those premium increases. Also, Medicare Supplement Plans don't cover any extra benefits such as dental or vision. They only cover hospitals and doctors and medically necessary care. So whatever Medicare pays a portion of the bill on, your supplement will pay their portion on. Another option that people might consider is a high deductible Plan G or Plan F. Those plans will have a lower monthly premium, but you'll have a higher deductible. So if you're interested in a Medicare supplement plan, when you're new to Medicare, you must sign up for a plan within 6 months of turning on your Medicare Part B, or else you will probably have to have health questions. Now, there are some special enrollment rules which allow you to get on a supplement plan if you are on Medicare and you have an employer plan and you decide, or you get fired or laid off and you lose your health insurance, then you may have the ability to get a Medicare supplement plan. Otherwise, you need to make sure you get a supplement plan within 6 months of turning on your Medicare Part B. Or for many people, it's when you turn 65. People love Medicare supplement insurance. They can just pay their premium, forget about it, and not worry about which doctors they go to, and not worry about referrals, and you don't have to worry about hospital bills and co-pays. That's a beautiful way to have health insurance. It's one of the best plans you can get. The other way to get Medicare is really not Medicare per se. However, you have to be enrolled in Medicare. It's known as Medicare Advantage. Some people love Medicare Advantage. Some people hate Medicare Advantage. Some people don't even know what it is. Some people think it's supplemental insurance. Medicare Advantage is not a supplement to Medicare. It's a private alternative to Medicare. The insurance companies get paid quite handsomely by the federal government. They get a lot more money for Medicare Advantage than they do for supplements. Therefore, you may see a lot more advertisements for Medicare Advantage. You might see TV commercials from the insurance companies. Some of these call centers in years past have really done a lot of damage, if you ask my opinion, on overinflating these benefits and making them seem too good to be true. Free groceries, free this, free that. Get money back on your Social Security check. All the wrong reasons you should get Medicare Advantage. The reason you would want to consider Medicare Advantage is it makes sense for you. In other words, your doctors are in network. Now, a caveat, your doctor can be in network today, but in the middle of the year, they can leave the network and you may not be able to change your plan in most cases. If your doctor leaves the network, you would have to find a new doctor that's in network unless you want to pay the whole bill if you're on an HMO plan, or a larger percentage of the bill if you're on a PPO plan, preferred provider organization. Now, the providers are not required to accept your insurance if you have a Medicare Advantage plan. Just because they accept Medicare doesn't mean they're going to accept your Medicare Advantage plan. So if that's a concern of yours, you just need to be aware of that going in. Don't buy these plans for all the bells and whistles. One of the main reasons people get attracted to Medicare Advantage is because of a low monthly premium. Many plans, most people that have Medicare Advantage have a 0 monthly premium or a very low premium, maybe $25 a month or less. Maybe more, but the vast majority of people that have Medicare Advantage have a low monthly premium or even a 0 premium. Some will even offer you a give back on your Social Security check. Be very careful. Don't get Medicare Advantage again for these perks. Make sure it is a good fit for you. Another thing you need to be aware of is when you're brand new to Medicare, typically you have a 1-year trial run where you can take Medicare Advantage out for a test drive, so to speak. So basically, when you're signing up for Medicare Advantage, you're handing the keys of your Medicare car to the insurance company. Medicare is no longer driving the car. You don't have a supplement plan riding shotgun. You only have an insurance company running the show. Now, the government, CMS, the Center for Medicare and Medicaid Services, is overseeing the Medicare Advantage plans. Also, Medicare Advantage plans all have prior authorization for big ticket items such as MRIs, surgeries, maybe chemo, different tests that need to be performed. You may need that right away and your doctor says you need it right away. If you're on traditional Medicare with a supplement plan and you need an MRI and they have an opening the next day because someone canceled, you may be the first person they call because you have regular original Medicare and a supplement. If you're on Medicare Advantage, you may have to wait an extra week or two or longer to get that MRI. Delayed care often results in bad outcomes. Most people that have Medicare Advantage like their plans, but there can can be speed bumps or hiccups, and there can be outcomes that are not favorable. You may have to file appeals or grievances to get things done and get things paid. We at Senior Solutions Group often spend a lot of time on the phone with our clients and with insurance companies, even doing three-way calls, doing this very thing for our clients, because it can be an issue. It's a value-added service that your agent should be offering you. If they're not offering this to you, you need to maybe look for a different agent. So one of the things you need to be aware of when you have Medicare Advantage is you may not be able to go back to a supplement plan willy-nilly, because if you decide now I want to go back to traditional Medicare, unless your plan leaves, which Medicare Advantage plans can exit after each year, they go on a year-to-year contract with Medicare. So you could get a letter from your Medicare Advantage plan saying, you know what, we're leaving the area. Now it's not going to be worded that way, it's going to be an official letter, but they're basically saying we're not making money in this county anymore, we're leaving. And it's not just you they're singling out the whole population of people in the county. So where we live, we had 2 carriers leave our area last year, and we actually had to have meetings at our local convention center because it affected so many people. If you're on a Medicare supplement plan, you'll never get a letter like that. You will get rate increase letters. And you'll also have to shop your Medicare prescription drug plan options usually once a year during the fall between October 15th and December 7th. So let's talk about October 15th through December 7th, also known as the Medicare Advantage annual election period. That's the time when you can sign up for a Medicare Advantage plan for the first time or for the second or third time if you want to change your plan. People that are on Medicare Advantage also have an additional 3-month window between January 1st and March 31st when they can either go back to regular original Medicare or switch to a different Medicare Advantage plan. People who are on Medicare supplement insurance cannot sign up for Medicare Advantage during this window. That's only for people on Medicare Advantage plans. Just be aware of that. So when you're new to Medicare, whether it's June or July or August, September, or October, you have 6 months to sign up for a supplement. You have typically 3 months to sign up for a Medicare Advantage plan. Just remember, there are a lot of enrollment windows, and if you haven't read the Medicare and You Handbook, which comes out every year, you need to be aware that you could end up paying late penalties if you've missed these deadlines. If you don't have an agent, if you don't know what to do, if you're stuck, if you're getting information from one friend, another information from your brother-in-law, telling you conflicting information, find an agent who can help you with these important decisions. These can affect your life. You're stressed out about medical bills, about which doctors you can see. If your plan's working, that could lead to more health problems. That's the last thing you want. So reach out to an agent. If you don't have an agent, we are always available. We are here for you as well at Senior Solutions Group. I've been doing this since 1995. I love my job. I love helping people. Our team loves helping people. Feel free to subscribe to our channel and please share this with a friend. This is important information. It's not milquetoast information. It's important. Thank you so much and have a great rest of your day.